everybody. Welcome to DE Business Lab. I'm Dr. Pam Maragliano Muniz, Chief Editor for Dental Economics Magazine. And with me is one of my favorite guests, Kandra Sellers of TIPS Medical Billing. Kandra, welcome.
Thank you so much. I'm
So
excited to be here.
I'm so happy to have you here. So it's the beginning of the year-ish. Obviously it's not right at New Year, but we're kind of in it now. And we all go into the new year, whether you're a New Year resolution person or not. We kind of go
Mm.
in with usually either an expectation or at least some sort of hopefully positive, affirmation that you're going to go in and be like, I'm going to make this a great year. And I want to have a great practice year. I want to lose weight. I want to eat better. I want to exercise. I want to be a better person this time next year than I am right now. And there's different sentiments that we could bring into our practices, specifically around limiting beliefs. Whether believing we deserve what we're getting paid or our patients deserve a certain level of care. Can you share your perspective on this topic?
Yeah, absolutely. Every year I just look at how how do we stop the hemorrhaging in our practices, like like without a pun there, but how do we stop that, and how do we stop this ball and chain um, concept that we have around dental benefits? How do we serve more patients at a higher level, and just serve patients and be more patient centric? Um, how do we stop that limiting belief that we can only see patients for this population, or that have dental benefits? And how do patients stop having the limiting belief that they can't come in and see us because they don't have dental benefits? I mean, there's so many limiting beliefs around dentistry, whether it's how much, like you said, whether it's how much we get reimbursed, when we can bill things out, when we can't, how often we can. Like, how do we stop all of it? Because in my mind, and there's so much conversation about dropping PPOs right now, how do we sustain? Well, I kind of feel like what we're getting paid with PPO plans being in network, I don't know how we sustain. Because when you're getting on average $36 for an evaluation, holy moly. It how do you do that? You can hardly pay you can hardly pay your hygienist. I get that. I feel like this time of year we're setting goals around, we want to be $1 million practice. How do we do that? Well, if you have 1,000 patients, you better max out their $1,000 on every single patient to get to 1 million, right? What really started this thought process for me was I saw somebody post, somebody is prominent in the dental industry, and I saw his Facebook page, and he posted, I have it right here, that he's going through cancer therapy. And it says total cost of my care this year, I'm just going to round it up to $1 million. Cost $1 million for his cancer therapy this year. And his insurance carrier wrote off almost $1 million. He paid about $6,000 out of pocket. Not a lot for $1 million worth of treatment and saving his life. But that's one patient that contributed $1 million to the healthcare system, to the cancer center, wherever he's getting his treatment. We work really hard to get $1,000 on every patient to have $1 million practice. Like, I don't understand how we got so backwards on how we're reimbursed and when we're reimbursed. And how do we stop the limiting beliefs, and pick up the ball and chain and run with it, like a prisoner on the loose? Like, how do we start being paid as a medical specialty, because you really are. And that's where I think medical billing comes in, is once you have, like, as an example, a CT. Most practices don't bill that CT because they know dental's not going to pay for it. Same thing with bone grafting and many other things. There's tons of stuff on your dental fee schedules, but half of the stuff doesn't have benefit to it. So we just don't bill it. Well, it's not sustainable. But now if you have this other entity called medical billing that you can bill to, why wouldn't you? And guess what? Doesn't have $1,000 max. It's unlimited. Clearly, this person had $1 million in treatment last year. So it's kind of, we've just kind of put ourselves in this little box. And I don't know how we get past that limiting belief that we're worthy of being reimbursed as a medical specialty. And our patients are worthy to come and see us. And this time of year, we're making goals for new patients. How many new patients could you see that don't have dental benefits? Just to get them in and get an eval, find disease that needs to be treated that's affecting their systemic health. Who was the sports person that just died?
Oh, the
Just
guy with the
passed
great,
away. Had a
yes.
toothache, right? That happens. I have a friend that's a transplant nurse. It happens a lot. Something so preventable. But what happens is people that often don't have dental benefits don't go to the doctor to get to a dentist to be seen. They go to an ER. So how do we help more patients while being reimbursed and getting our shifting our mindset into a better place that's more profitable? I mean, we all have a business to sustain.
I think it's such an interesting concept, especially because ever since COVID, we have had our bottom line has gone up so significantly, and reimbursements from PPOs specifically are on the decline. And even the better plans out there, I'm putting them in air quotes because none of them are great, are reducing their reimbursements. And it's been speculated by a lot of experts out there that, when we ride this out long enough, even the better plans are going to have reimbursement rates similar to that of a PPO. And so that puts a particular stress on the practice to either produce more, do more, use cheaper materials. And there's this sentiment of stepping over dollars to save cents when there's this whole other opportunity for us that we should maybe consider and explore for our practices. And it's not just for a surgery practice, right? I mean, I think that you hear medical billing, you're thinking, oh, it's probably for, surgeries or things that maybe a general practice don't perform those types of
Mhm.
procedures. But that's truly not the case. A lot of your clients are general dentists, aren't they?
Absolutely. Yeah, almost all of them are. Absolutely. And how many patients come in for evaluations for even if it is a surgical case, or even if it is that patient that has a toothache and they blow up your day, and now you're doing, oh, guess what? You're doing same day surgery too. And or I mean, because I really do consider taking a tooth out with something we're so used to. We don't, we're so used to seeing pain, infection and treating it and not maybe being reimbursed for it or billing for it. But those are we're a surgical operatory. There's a reason why it's called an operatory. And whether we're cutting tooth, bone, or tissue, we're doing surgery in our practices every single day. And we're just so used to it, and we're so used to being reimbursed so poorly. Um, how do we get out of that mindset? So many people talking about dropping PPOs, and how do we, even if you stay in a PPO, look for the other opportunities that all the stuff that dental's not paying for is likely billable and payable on the medical side. So don't keep giving it away, because we know we have another way to go. And in fact, if you look at, $1,000 benefit for a patient, that's gonna cover maybe preventative. That's really all it is a preventative plan, which is just as good as an in-house plan that you might have. In fact, the in-house plan is probably better for everybody involved, because now we take the patient off of that. Oh, I only have $1,000 this year, because they don't. They have whatever they want to do, and they don't have that max. It's just a mind shift, even for the patient in an encounter like that where there's an in-house plan. So there's lots of different ways to look at it, and lots of different um, ways to think about how you move forward in the new year. But there is thousands of dollars waiting on the medical side for dental practices to bill. I think I shared with you too, from a PROS standpoint, patients that come in with cancer, or oral cancer. How do we get them the treatment that they need and deserve, because their cancer is destroying their mouth, you know? We can do that on the medical billing side and help them instead of asking them to pay for it out of pocket. So it's just knowing how to do that and having the support in place to do that. We're going to be kicking off launching a cancer program, mainly starting with oral cancer because that's our wheelhouse. But for helping practices that have patients that are in that situation but don't have implemented medical billing, so they don't know how to help the patient. We want to help the patient. And my business has always been patient centric. Yes, I want to elevate our profession. I want us to make more. I want us to sustain more. But at the end of the day, without our patients, we have nothing. So, and as a hygienist, that's why I went into it, to help patients. So, yeah, I think there's just so much opportunity in 2024. And I only see this getting more and more of a common thing that patients are going to be asking for.
So, as we're kicking off the new year and we've created goals and we're trying to figure out how we're actually going to achieve them, it sounds to me like it behooves all of us to at least explore what that would look like for our practice. And you, Kandra, are going to be at Chicago Midwinter and
Yeah.
meeting with dental practices to do just that, explore what that would look like for your particular practice. Could you share what that looks like?
Absolutely. So my time during Chicago Midwinter is meeting with people that practices that want to investigate their opportunities for medical billing. And basically, I offer a complimentary medical billing analysis. And there's nothing better for me and typically for my clients than to meet in person. So if you are going to be at Chicago Midwinter, feel free to reach out to me at Kandra@tipsmedicalbilling.com or check out my website. You can reach out through the contact page there. Tell me a little bit about you and we'll get together and chat about, and I'll analyze, I'll not just chat with you, but I'll analyze the numbers that you have and sit down and really show you what does this look like for you? And how do we make this customized to feel comfortable for you and your team? So it's an exciting time. It's a great opportunity to be able to meet in person.
It's an amazing opportunity. And I think you should get some coffee, eat your Wheaties, because I think you're going to be so busy at Midwinter. So I look
Absolutely. I
forward
would
to
love that.
I look forward to seeing you there, and definitely check out tipsmedicalbilling.com so you can get on Kandra's schedule. And I look forward to seeing you again.
Awesome. Thank you so much.
Thanks for joining me. For DE Business Lab, I'm Pam Maragliano Muniz, and we'll see you next time.